Understanding your baby's cues can feel like learning a new language, especially when some signals seem similar but have completely different meanings. Many parents unintentionally misinterpret certain behaviors, which can lead to frustration for both parents and baby. In this video, we'll discuss 4 confusing cues that most parents misread and what these cues really mean. By understanding these subtle signs, you'll be better equipped to respond to your baby's needs and build a stronger connection. The first confusing cue is fussing with clenched fists. Many parents assume that clenched fists mean their baby is tense, angry, or frustrated. However, clenched fists in infants are often a sign of overstimulation or hunger. When babies are overwhelmed or hungry, they may tense their bodies and clench their fists as a response. If you notice this cue along with other signs like rooting or turning their head toward you, it could be a sign that they're ready for a feed or need a break from stimulation. Next is rubbing their face or tugging at their ears. Many parents think these behaviors mean that their baby is in pain, particularly if they're tugging at their ears, which can be associated with ear infections. However, in young babies, face rubbing and ear tugging are often signs of tiredness. Babies may rub their face or tug at their ears as a way to self-soothe when they're feeling sleepy. If you see these cues alongside yawning or droopy eyelids, it's probably time for a nap rather than a visit to the doctor. Another commonly misread cue is arching the back and turning away. This can be confusing because arching can look like a sign of discomfort or frustration. In reality, arching the back is often a signal that your baby is feeling overstimulated or has had enough, especially if they've been feeding or playing for a while. Babies use arching to create some distance and signal that they need a break. Instead of assuming they're in distress, try giving them some quiet time or switching activities to help them reset. The last cue is frequent hiccups. Some parents worry that hiccups mean their baby is uncomfortable or has an upset stomach. But in most cases, hiccups are simply a natural part of a baby's digestive process, especially after feeding. Hiccups can happen when babies swallow air during feeding or when their immature digestive system reacts to changes in feeding. They don't usually indicate any discomfort. If your baby seems happy otherwise, hiccups are nothing to worry about. Gently burping them during feedings or offering a pacifier can sometimes reduce hiccups. By understanding these 4 confusing cues, fussing with clenched fists, rubbing their face or tugging at their ears, arching the back, and frequent hiccups, you can better interpret what your baby is trying to tell you.